Hello and welcome everyone. Today our topic of discussion is calcium. Calcium is the most abundant mineral element in the body. About 98% of 1200 gram of calcium in adult is in the form of hydroxyapatite in skeleton. Hydroxyapatite is a lattice-like crystal composed of calcium, phosphorus and hydroxide. The remaining calcium is in the extracellular fluid and in various tissue, especially skeletal muscle. 80% of this calcium come from the food and 20% of is provided by drinking water containing calcium. Calcium is maintained within a fairly narrow range from 8.5 to 10.5 mg per dl in serum. Let's see the functions of calcium. Calcium forms and keeps strong bones and teeth. It helps in nerve conduction. It helps in muscle contraction. It supports normal blood circulation and it helps to release hormones. What are the health benefits of calcium? It maintains strong bones and teeth. It prevents osteoporosis and colorectal adenomas. It lowers cholesterol values. It is also associated with reduction of hypertensive disorder of pregnancy, and it also associated in lower blood pressure in the progeny of mothers taking sufficient calcium during pregnancy. Let's understand food sources. Hard cheese. It contains 1 gram of calcium per 100 gram of cheese. Second is milk and yogurt. It contains 100 milligram to 180 milligram per 100 gram of milk or yogurt. Nuts like almond, sesame, chia seeds, they contain 250 to 600 milligram per 100 gram of nuts. Vegetables like kale, broccoli, watercress, they contain 100 to 150 mg per 100 gram of vegetable. This table shows the adequate intake of calcium per day for each group of individuals. In adult, 1000 milligram calcium is required per day. Now let's understand what is the sample to be collected to test the calcium test in laboratory. The samples required are serum sample either in serum separator tube or the plain tube. Other sample are lithium heparin plasma and urine. EDTA and citrate plasma samples are totally unacceptable. Separated serum or plasma should not remain at 15 degrees centigrade to 30 degrees centigrade longer than 8 hours. If assays are not completed within 8 hours, serum and plasma should be stored at 2 to 8 degrees centigrade. If assays are not completed within 48 hours, the separated sample to be stored beyond 48 hours. Sample should be frozen at minus 15 to minus 20 degrees centigrade. Fasting is not required to test calcium. Now let's dive deep into the methods to detect calcium. Atomic absorption spectrometry or spectrophotometry is most reliable method, but it requires specialized and expensive instrument, making it unsuitable for routine assay in clinical laboratories. The most commonly used approach is colorimetric method, which employs chelators such as ocpc, which is O-crysolphthalene complexon. Second is methyl xylenol blue MXB. Third is arsenazo 3 AZ3 and fourth is chlorophosphanazo 3 CPZ3. Now let's understand colorimetric method. The calcium OCPC procedure is based on calcium ion reacting with OCPC in an alkaline solution to form an intense violet colored complex which maximally absorb at 577 nanometer. 8-hydroxyquinoline is added to remove interference by magnesium and iron. In this method, the absorption of calcium OCPC complex is measured bichromatically at 570 or 660 nanometer. The resultant increase in absorbance of reaction mixture is directly proportional to calcium concentration in the sample. Next method is photometric method. Calcium ion react with 5-nitro, 5-methyl, 1,2-bis O-aminophenoxyethane tetraacetic acid, also called N,M-bapta, under alkaline condition to form a complex. This complex reacts in the second step with EDTA. The change in absorbance is directly proportional to the calcium concentration and is measured photometrically. It is measured at 340 nanometer. The next method is fluorometric method. It is a simple method of detecting calcium in physiology solutions by using red fluorescence probe. The fluorescence signal can be easily read by fluorescence microplate reader at 540/590 nanometer. Let's understand different form of calcium. The serum calcium exists in three distinct forms. First is free calcium ion, which is 48%. The second is protein bound calcium, which is 45%, and complexed calcium mainly associated with citrate, which is 7%. The measurement of total calcium is misleading in cases of hypoalbuminemia, like in those suffering from hepatic or renal disease, burns, cardiac failure, or malnutrition. The corrected calcium equation in cases of low albumin are calcium in millimole per liter plus 0.02 into 40 minus albumin gram per liter. In critically ill or post-surgical patients, the correcting total calcium for albumin is not necessarily accurate because of changes in the pH and affinity of calcium binding. Values for total protein, albumin and globulin were utilized for derivation of calculated ionic calcium by using this formula. First is percentage protein bound calcium is equal to 0.8 into albumin plus 0.2 into globulin plus 3. Now, calculated ionic calcium is equal to total calcium minus protein bound calcium. The another simpler equation for ionic calcium is 0.815 into square root of total calcium. The ionized calcium is mainly detected by ion selective electrodes. These are the reference range for calcium. For total calcium, the adult reference range is 8.5 to 10.5 mg per dl, and for ionized calcium, the reference range is 4.5 to 5.6 mg per dl in adult. Important point, a dietary intake of 100 mg per day is recommended for adult. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.